Most of the countries and most of the international organizations that were trying to do something about the AIDS problem in Africa thought that it was too expensive to actually treat people, even though in the Western world for more than a decade we had known how to use antiretroviral drugs to keep people alive. Certainly we had nothing that approached a cure, but we had drugs that could make this a sort of a chronic disease rather than a death sentence. CHI started with a real focus on getting treatment started for people who were suffering from AIDS in developing countries. We would go into countries where the presidents or the prime ministers of the country very much wanted to do something about the AIDS problem, realized their people were dying. They wanted to get some treatment started. They wanted to keep people alive as long as they could. Our strategy was to go into those countries, work with the governments to put together plans to treat people, to bring teams of businessmen together. They were teamed up with healthcare partners, which are mainly academic institutions who could get things organized on the ground so that we could train people on how to administer these drugs, and then to strengthen the logistical systems so the officials in the countries would know how to order the drugs, how to accept the drugs, how to store the drugs, how to distribute the drugs. We had developed certain competencies, experience, knowledge that we realized could be applied to other health problems in the developing world, in the countries where we were already working. So one of the first areas we went into was malaria, and tried to work on getting the price of malaria drugs reduced quite a bit. I think everybody in CHI has been certainly very proud to have had a role. We weren't the only people involved in trying to get treatment started, but we certainly had a major role, and it's something that I think all of us will be proud of for the rest of our lives.